Good morning, sir. For the clinical psychology activity, I have chosen a disorder that not many people have much spoken about. So before I go into what disorder it is, let us look into one scenario. So a 2-year-old female was brought to the emergency department for blood in her diaper, and the physician had performed complete history and physical examination, including lab studies. And after the results came back normal, the little girl was discharged home with her mother. And a couple of days later, the mother had returned the daughter back to the emergency department again, complaining that there was again blood in her diapers. And then again, like a detailed medical history was done, including medications, finding out the medications used during pregnancy, the APGAR scores, etc. And the daughter was admitted to the pediatric floor for observation. And the mother appeared anxious, but was very helpful with the staff. Every morning, she was present for the attending physician's rounds and purchased donuts for the entire staff. And the results also returned within the normal limits. The mother, however, became very agitated and insisted on a second opinion, and the attending physician agreed. And the next morning, the nursing staff paged the physician to report to the mother and took the patient, reported to the physician, and apparently the mother had taken the daughter and gone away in the middle of the night. So this is one scenario. So basically here, the disorder I was talking about is Munchausen syndrome by proxy. So here it is a factitious disorder. It's also known as a factitious disorder by proxy. It is a psychological disorder characterized by pattern of behavior in which someone, usually the mother, induces physical ailments upon the other person, and that other person would usually be a child. And very famous line from Eminem's song cleaning out my closet was that my whole life I was made to believe I was sick when I wasn't till I grew up. So this is one characteristic thing the victims of Munchausen syndrome by proxy believe. So like the mom or the caregiver makes the person who's under their care believe that they're sick, and even they go to the extent to which they gain attention from the hospital staffs and authorities for having to take care of somebody sick. So facts about Munchausen syndrome by proxy. Women are most often the perpetrators of the syndrome, and the victims would most often be the woman's child. And in around 95% of the cases, the mother is the one abusing the child this way. And in other cases, the father, grandparent, or even the babysitter may be the abuser. And people with Munchausen syndrome by proxy often express extreme love and attentiveness towards their children. And the major trademark of this disorder is causing just enough harm to the victim so that they can gain enough sympathy from the people who will be attending towards the child and but they would not impose enough harm to like that would cause the child to die. And they must injure their child over and over again to get all that consuming high, causing harm to the child and getting attention from the people around them is what gives them the high. And it is they use very thoughtful operations in how they inflict harm upon the child. It could be through injecting air or fluid into their body through an IV, or it could and they must be very careful to harm the child in such a way that it can't be detected very easily. And the symptoms of the syndrome are very hard to identify, but are most prevalent only when the child becomes sick in the presence of the mother. So usually in the cases that are brought forward because of Munchausen syndrome by proxy, the symptoms that the mom keeps saying is only shown when the mother or the caregiver is present around the child, and usually when the caregiver is not present, these symptoms are not shown. And the mother always, like the mother or the person who inflicts the harm upon the child, usually maintains a very dynamic relationship with the physician or the people taking care of the child. So so as to get enough attention from them. Talking about the criteria for Munchausen syndrome by proxy, intentional production or feigning of physical or psychological symptoms in a person under one's care, and the perpetrator is motivated by assuming the sick role by proxy. So basically, they are motivated to be the caregiver of somebody sick. And the external incentives such as monetary gains or anything of that sort is absent usually, and the behavior is not better accounted by any other disorder. So the subtypes of Munchausen syndrome by proxy could include episodic intervals when the person experiences symptoms of Munchausen syndrome by proxy. That is, it won't be there all the time, but during certain stages or events of their life, they might feel like showing out such traits. And mild is for receiving the emotional gratification from the medical staff, and intense would be to induce any kind of severe illness in his or her own child. And the talking about incidence and prevalence, 1% of the children with asthma have been subjected to Munchausen syndrome by proxy. In another report, children with food allergies, around 16 out of 301, that is 5% of the children with food allergies have been subjected to Munchausen syndrome by proxy. And around 2.8 cases per 100,000 children younger than 1 year, 0.5 cases per 100,000 children lesser than 16 years. So basically, as the child's age is lesser, the cases of Munchausen syndrome will be higher. And as the child's age increases, the mother or the caregiver can't really start faking symptoms, because probably the child might start to understand that there's nothing really wrong with them, and it's really what the caregiver is doing to them. So there's one very interesting movie also that really portrays the Munchausen syndrome by proxy. It's called Run. So the mother, the child was born normally, but then the mother induces symptoms into the child by giving the child medicines that's not even related to human beings. Like the medicine is for animals, like dogs. It is a relaxant in dogs, and when humans take it, it paralyzes them bottom down. So the story is about how the girl finds out that the medicine is not really for her, and she goes about finding out the reason as to why the mom is inducing such symptoms in her. Then the presentation of the Munchausen syndrome by proxy. So the victims could usually be divided between males and females. So it doesn't really have to be a male, or like the gender of the victim doesn't depend here. And children mostly at risk are between the ages of 15 months to 72 months. Then the victims frequently have baffling symptoms and see multiple healthcare providers before a diagnosis of Munchausen syndrome by proxy is made. And in most of the cases, around 98% of the cases, the perpetuator is the biological mother. And the characteristics of the perpetuator is that they're usually female, and they must have experienced some kind of marital discord, and they must be having, they would be having a lot of knowledge in healthcare or in training about healthcare. Then only basically they can induce this kind of symptoms on their child. And they would be usually friendly and cooperative with the staff. They would be showing a lot of love and attention towards their child, and they might also have had a history of abuse or any other psychiatric disorders in the past. Perpetrators of Munchausen syndrome by proxy may be help seekers who search for medical attention for their children to communicate their own exhaustion, anxiety, or depression. And others may be active inducers who create their child's illnesses through dramatic measures. And these parents are typically anxious, depressed, or even paranoid. And finally, some may be doctor addicts who are obsessed with getting treatment for their child's non-existent illnesses. So the ways that Munchausen syndrome by proxy can be present includes a complex pattern of illness and recurrent infection without a physiological cause, and seizure activities that would probably not respond to the medications that are given by the doctor. And usually the seizures are only present when the caretaker is there. So, and also bleeding from anticoagulants and poisons, the use of caretaker's own blood or maybe red colored substances to stimulate bleeding, or maybe vomiting precipitated by IPEAC administration. That is basically a medication to induce vomiting, and diarrhea induced by laxatives or salt administration. Then there's hypoglycemia from administration of insulin or hypoglycemic agents. So basically the sugar levels in the body will be lesser than how much it should be by administration of insulin and all that. So the kind of illness that can be demonstrated on the child would vary from caregiver to caregiver. So these are the ways they would probably induce such illnesses, and rashes could be caused from caustic substances applied to the skin. So the diagnosis about Munchausen syndrome by proxy could be very difficult, as probably they always come up with a physical presenting illness. So they would go to physicians and they would do a lot of tests to rule out a lot of things. So the time taken to diagnose Munchausen syndrome by proxy would be very long, and it cannot be made very quickly because there will be physical symptoms that the mother complains of. And the victim's signs and symptoms are usually one way to detect is because it will be very very inconsistent or undetectable, and the symptoms would be very confusing and would mislead the doctors very often. So, and also the victims of Munchausen syndrome by proxy might have to go through a lot of unnecessary tests and treatments that can be even painful and dangerous. Because the caregivers seems so genuinely concerned, it is often hard for the doctors to probably understand the problem. And by the time they understand, it could be too late, that there must be enough harm for the child caused on the child that the child could even die. And investigation tests that the emergency physicians may consider to understand whether the child has Munchausen, the caregiver has Munchausen syndrome by proxy includes urine toxicology screenings, chemistry panels, ECG, and drug levels for suspected poisoning. So in the previous slide, as I mentioned, certain medicines can be given to induce the illness. So testing the drug levels to identify such poisoning agents. Then the cultures and coagulation tests and head CT scan could be done to understand if this disease actually has a cause or is it being faked or something. Then certain questions we can ask to identify such a case would be, that is, are the history and signs of the symptom of the disease believable? Is the child receiving unnecessary, harmful, or potentially dangerous testing and medical care? If so, who is prompting the evaluations and treatments? And during clinical assessment, is the child's medical status consistent with the mother's description? And does the objective diagnostic evidence support the child's reported medical condition? And has any staff member, including pediatrician, have they witnessed the symptoms? And do negative test findings reassure the mother that the child is okay or not? And is the treatment being provided to the child primarily because of the mother's persistent demands, or is it because the pediatrician or the physician actually sees certain symptoms in the child? So the warning signs of Munchausen syndrome by proxy could be that the illness in the child would be multisystemic, prolonged, unusual, or rare, and the symptoms that are inappropriate or incongruent. There would be multiple allergies in the child. The symptoms would disappear usually when the caregiver is absent. And during consultation, usually only one of the parents would be present. That would either be the mother or the father. And there would be chances of history of sudden infant death syndrome in the child's or the victim's siblings. And the parent would be overly attached to the patient. The parent could have a medical knowledge or background, and the child would have poor tolerance to the treatment. And the parents who encourage medical staffs to parents would encourage the medical staffs to perform numerous tests on the child, and the parent shows inordinate concern for the feelings of the medical staff as well. So talking about morbidity and mortality rate, the death, or like the amount of death that happens because of Munchausen syndrome by proxy is not precisely known, because as I said before, it's very difficult to detect Munchausen syndrome by proxy. But mortality rates are around 9 to 31%, and the morbidity can be a direct result of the abuse or a consequence of multiple diagnosis and therapeutic interventions performed by unwitting physicians facilitators. So basically, it could either be due to the harm that the mother is directly inducing on the child, or it could be a result of the side effects of the treatment that the physicians unknowingly would be having on the child. Then talking about the treatment, it is difficult to treat people with Munchausen syndrome by proxy because they are usually unwilling to accept that they have a problem. And the doctors have to investigate the patient's medical history and perform medical tests to confirm that the problem is psychological rather than being physical. And the treatment for the syndrome usually involves psychiatric counseling to change the thoughts and behaviors that are causing this condition in the caregiver. And the child, immediately as soon as the diagnosis is made, needs to be taken away from the caregiver before any further harm could be done on the child. And the child may need treatment for both physical complications and for both physical complications and the psychological scars of the abuse. Then the prognosis of this syndrome could be that around 10% of the children who are victims to this could possibly die because of the harm caused by the caregiver, and others could further go on to develop the same syndrome as they grow up. So to conclude, Munchausen syndrome by proxy is a covert and serious form of illness that a child receives because of the caregiver, and in most cases, the perpetrator is the mother. And the child may have a combination of symptoms and signs that does not conform to any known disease and that does not respond to the routine treatments. Thorough evaluation of the child and verification of the pertinent medical and social histories are required to confirm this diagnosis. And obtaining medical records from previous hospitalizations and medical evaluation is important in identifying this disorder. Body fluids, including blood, should be tested and ensured any questionable specimens are in the child. A multidisciplinary team approach is mandatory to confirm the diagnosis and protect the child. Long-term psychiatric follow-up treatment of both children and the perpetrator is needed. And investigating and reporting Munchausen syndrome by proxy can be both challenging and risky to the caregivers. And finally, we need to educate physicians, social workers, and other health workers about this syndrome and establish local task forces to facilitate timely diagnosis and manage the disorder. So basically, this is the disorder I wanted to talk about, and it is very important to inform people who are concerned with the health authority to take immediate action as soon as they diagnose this disorder. So that's it. Thank you, sir.